Well, until several years ago, AMD, or age-related macular degeneration, really did not have much in the way of treatment available for it. But now I'm pleased to say that there are numerous very exciting developments, some that are very, very new, others that have been more established over the last 10 to 15 years. There are two main types of macular degeneration, and a lot of patients who suffer with this will have heard of the terms wet and dry macular degeneration. The dry type is where the macula, or that central part of the retina, is a little worn and torn. It's just not functioning well. It's just with the passage of time, and so hence the name AMD, age-related macular degeneration. And the wet type is where you have blood vessels growing underneath the retina. Now that accounts for only 5% or so of all of the macular problems that patients face. And the wet type has been amenable to treatment over the last 10 to 15 years with special injections in the eye. So a lot of patients who've had treatment for macular degeneration have had injections of one type or another to help to prevent those blood vessels growing underneath the macula and making the situation worse. And when that came out, that was very exciting, because prior to that there was no treatment at all for macular degeneration. Now, even the dry type of macular problem that patients can have, there is some light at the end of the tunnel for that particular condition. It's not my particular field, but my colleagues here at Moorfields who deal with that, there's some very exciting research on how to replace the cells at the back of the eye, how to use stem cells underneath the retina, even how to use electronic chips or the way of actually getting the best out of the optic nerve with lots of gadgetry and wizardry and computing power. And for that, I'd have to refer you to colleagues of mine that are at the coal face in relation to the macula. But it's not the sentence that it once was. And anyone who has macular degeneration should always now investigate possibilities and perhaps contact colleagues of mine at the Institute of Ophthalmology or here at Moorfields to see if anything could be done for their particular type of macular disease.